Cefotaxime, also known as Claforan Vial, is a medication that is used to treat many different types of bacterial infections. It can also be used to prevent infection after certain surgeries. This medication is part of a group of drugs called cephalosporin antibiotics, and it works by stopping the growth of bacteria. It is important to follow the dosage instructions provided by your doctor and to take it at the recommended times for the best results. When using Claforan Vial, it is important to follow your doctor's instructions for injection into a muscle or vein. If it is injected into a vein, it should be done slowly over at least 3 minutes to avoid potential side effects. The dosage will depend on your medical condition and how you respond to the treatment. If you are using this medication at home, make sure to learn the proper preparation and usage instructions from your healthcare professional. Before using it, check the product visually for any particles or discoloration and do not use it if either is present. You should also learn how to store and discard medical supplies safely. If you are using the frozen pre-mixed solution, thaw the bag at room temperature or in the refrigerator. After thawing, shake well and squeeze the bag to check for leaks. Do not refreeze the solution after thawing. For the best results, use this antibiotic at the same times every day. It is important to continue using this medication for the full time prescribed, even if symptoms disappear after a few days, to ensure the infection does not return. If your condition lasts or gets worse, be sure to inform your doctor. If you experience swelling, redness, or pain at the injection site, make sure to inform your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they have determined that the benefit to you outweighs the potential risks. Many people using this medication do not experience serious side effects, but it's essential to contact your doctor immediately if you notice any unusual symptoms such as easy bruising/bleeding, unusual tiredness, uncontrollable movements, mental/mood changes, seizures, signs of kidney problems, signs of liver problems, or fast/slow/irregular heartbeat. Additionally, be aware that this medication may rarely cause a severe intestinal condition known as C. difficile, so it's crucial to seek medical attention if you develop symptoms such as persistent diarrhea, abdominal/stomach pain, or blood/mucus in your stool. Do not use anti-diarrhea or opioid products if you have these symptoms, as they may make the condition worse. Long-term use of this medication may result in oral thrush or a new yeast infection, so contact your doctor if you notice any changes in your mouth or vaginal discharge. Although very rare, a serious allergic reaction to this drug is possible, so seek medical help if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. It's essential to be aware that this is not a complete list of potential side effects, so if you notice any other unusual effects, make sure to contact your doctor or pharmacist. And remember, if you are in the US, you may report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch, and in Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Claforan Vial, make sure to inform your doctor or pharmacist if you have any allergies to antibiotics such as penicillins or other cephalosporins. Also, let them know about your medical history, especially if you have kidney disease or stomach/intestinal diseases like colitis. Claforan Vial may affect the effectiveness of live bacterial vaccines, so it's important to let your healthcare professional know if you are using this medication before getting any immunizations or vaccinations. Additionally, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products, before undergoing any surgery. If you are pregnant, it's crucial to discuss with your doctor before using this medication. Claforan Vial can pass into breast milk in small amounts, but it's unlikely to harm a nursing infant. However, it's still important to consult your doctor before breastfeeding while using this medication. It's important to be aware that Claforan Vial may interact with other medications, potentially affecting how they work or increasing the risk of serious side effects. This is why it's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Before making any changes to your medication dosage, always seek your doctor's approval. Additionally, it's worth noting that this medication may interfere with certain lab tests, such as urine glucose tests, leading to false results. Therefore, it's essential to inform lab personnel and all your doctors about your use of this drug. If someone has taken too much Claforan Vial and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include seizures. As for the uses of Claforan Vial, it is used to treat a variety of bacterial infections such as skin infections, urinary tract infections, and pneumonia. The dosage and frequency of this medication will be determined by your doctor based on your specific condition. It is typically administered through an injection into a muscle or vein. It's important to follow your doctor's instructions carefully and to take the medication at the same time each day for the best results. It's important not to share Claforan Vial with others. When using this medication, it's essential to undergo lab and/or medical tests, such as a complete blood count and kidney function tests. It's important to keep all medical and lab appointments to monitor the effects of the medication. Make sure to take Claforan Vial as directed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist for a new dosing schedule. Do not take double the dose to make up for a missed one. Be sure to follow the storage instructions provided with the Claforan Vial and keep it out of reach of children and pets. Do not dispose of the medication in the toilet or drain unless directed to do so. Properly dispose of any expired or unused medication in consultation with your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.